Hi everyone. Today we have amazing opportunity to meet with our future International Headache Society president, Dr. Mario Perez, who got awarded this excellent editor's choice article about call to action for treating people with migraine, diagnosing migraine, talking about burden of disease. So please, Dr. Mario Perez, tell us a little bit about yourself.
Well, first, thank you, Nina, for inviting me. Thank you, Simona, for picking this paper for the Cephalalgia choice. It's really, I think, it is really important to talk about migraine, underdiagnosis, under treatment, and I'm a neurologist. I work in São Paulo, Brazil. And we are about 1 year to IHC 25 that for the first time will be here in Sao Paulo, actually for the first time in Latin America. So we are very happy, very proud to host, and we wait for everybody to come. It's going to be really a very, very good Congress. Unbelievable experience, and everybody should come. So about our paper, Nina, the idea was to take advantage of this last publication and update about the global burden of disease publication in Lancet Neurology about burden of neurological disorders worldwide. An update from the 2021 data. So for the first time, we are getting COVID related data, but more than that is the opportunity to stress again and again how much migraine is a debilitating condition. So we took the opportunity to write about those numbers and stress them, and claiming and start a call to action for several important measures that we should do in terms of public policy, in terms of population-based management for headache disorders. So the first thing is summarizing a bit what the GBD Lancet Neurology paper is showing us is that migraine affects 1.16 billion people worldwide. It is 14.7% of the population. It's nice to compare with hypertension because, migraine is a non-communicable disease, is a chronic disease, but in general, it's not in the agenda for surveillance, for public policies. So hypertension is always considered the number one or the very first chronic condition that public policies take care of. So if migraine affects 1.16 billion people, hypertension prevalence is similar. It affects 1.25 billion people. And another very important concept is what we call the treatment cascade, where if you could show the figure of the paper somewhere, then it is this figure showing that we have the number of people with the prevalence, the number of people who has the disorder, and then the number of people that are diagnosed. And, it's less than 50% in migraine. So most people with migraine don't know they have the disease, are not diagnosed. So this is the first step and the first important measure that we need to address. So an incredible number of diagnosis of migraine. And then the next thing will be under treatment, because how many patients have access to specific medications for in terms of acute treatment, but more importantly, how many patients are candidate for prevention and are really taking prevention. So in average, we could say 25 to 30% of migraine patients are candidates for prevention. So we're talking about 300 million people to 400 million people, depending on the criteria. But, worldwide, even in high-income countries, the number of people who are really having or taking anything for prevention is very small. It's like 20%. So there is a huge under-treatment, and that's migraine prevention in any aspect. So we have a lot to do. So we need to think on this number of 300 million people without migraine prevention. It is a very fair estimate, and what we should do about it. So we need migraine as a part of the surveillance of chronic diseases in countries. We need migraine as part of public policies. We need to improve access. We need to improve the understanding of the disorder by the general practitioners, by family physicians, by also nurses or social workers or health, social health persons. So, and we need a plan for decreasing this burden. So there are several ways to do it, and the idea in the paper is a call to action and to highlight some numbers and stress them again. So migraine is common, debilitating. Migraine is the first neurological disorder in kids 5 to 19 years old. Migraine is the first neurological disorders in Western Europe and Australasia. Migraine is the second most debilitating neurological disorders in several other regions of the world, and in adults from 20 to 59 years old, only after stroke. So it is definitely a very important disease, a invisible disease, because you don't have a marker for that, but many other diseases don't have, like depression, like other conditions. So it's really a lot of work in terms of awareness, and it is also critical to improve access to treatment for migraine patients.
This is excellent. So we need diagnose better, offer our patients acute and preventive treatments. And we do need to work with our public policies and advocate together, along with researching more, maybe looking for more biomarkers, and how do we work on diagnostic in the future all together. And we might be able to meet all together next September at International Headache Society meeting in Brazil, which will be fantastic meeting. I already can see that. There was a great teaser in the middle of this excellent interview about going to the Journal of Cephalalgia and looking at the figure and looking at the wonderful data which presented by Dr. Mario Perez and whole team. Congratulations again on the article Editors of Choice and Cephalalgia. We're looking forward for more research and education and advocacy coming from you. And would you tell us a little bit about your future plans within International Headache Society and maybe our journals?
Sure. Well, thank you again for picking our paper and letting the spreading the word is really, something very important, a topic very important for migraine patients, for our field. And I think, it's pretty much part of our agenda in terms of decreasing inequity in headache treatment, in headache research as well. I really think, and I will work hard for, and I'm already working for improving other countries, other regions in terms of better scientific writing skills, better knowledge regarding the disorders. So, more people taking care of headache. One idea of the meeting in Brazil here is to expand the field to other areas like we mentioned cardiology or hypertension. It is important to try to think how much of the migraine patient is seen by the cardiologist or by the general practitioners, the primary care physicians going regularly to consults. And it is a fantastic opportunity for diagnosis and for matching unmet needs, because if the patient is seen by this physician and is taking some medication for hypertension, let's make their life easier and put together a guideline or a set of instructions for them to improve the quality of life of their patients regarding migraine comorbidity. Also in psychiatry, also in other areas, other healthcare practitioners, but not physicians. Very important to address orofacial and improve the care that dentists may have and may help patients. Physical therapists, psychologists, nurses. So for sure, the number of headache specialists are by far not enough to take care of those 300 million people. So we need to plan and to understand that the workforce in healthcare needs a larger number. So even neurologists won't be enough to take care of all migraine patients. And that happens in psychiatry with depression and anxiety, that happens in endocrinology with diabetes, that happens in hypertension, in cardiology with hypertension. So migraine is something that the general physician also should know and get minimal skills to manage the disorder. So another important topic and another aspect that we should work heavily is going into pediatricians as well. So migraine is the #1 neurological disease in kids from 5 to 19 years old. So pediatricians should know about. If there is one disorder that a general pediatrician should know about, one neurological disorder, that should be migraine. And I think we have to expand our field in order to decrease the migraine burden that is enormous worldwide.
Wow, this is so exciting and very empowering for all our multidisciplinary teams to go and keep educating, advocating, and researching for our patients who live with migraine and other headache disorders. Thank you so much, Dr. Mario Perez,
Thank you,
and
Nina.
we hope to see you again very soon. Thank you.
Thank you very much.